Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. And as you know, tomorrow you guys have exam. So please subscribe this channel and watch the video, complete video. So yesterday we discussed a very important letter. That was a kind of a letter that has been coming regularly where the GP is known to patient. So you are writing to a GP and the patient is already known to GP. But this is the letter that came the last time as well. So I wanted to discuss a different letter to make sure that you understand the concept of the writing in the best possible way. So I will try my level best to make it sure that everybody understands it. And it is a very different letter, but again, my intention is to make it very easy for you so that you understand that you should not fall in the trap if this kind of a letter will not come. So what will happen? So I want to make sure that you understand what OET writing is all about. So suppose if by chance I do not get that letter because that has already repeated so many times, obviously OET will also try to make a different kind of a letter. So I'm discussing and I will take only 15 to 20 minutes. The time in my clock is 5 minutes and 11 seconds. I promise you before 30 minutes I will close it. So please be there and learn. So as I told you yesterday, you have to start from the start, from the end. आपको लास्ट से लेटर शुरू करना है. So I would be talking in Hindi and English mix to make sure that every kind of audience on my YouTube channel understands it. But at the same time, I would be speaking enough English words for the people who do not understand Hindi so that they do not miss out on anything. Okay. So first of all, you need to find to whom you are writing the letter. आप letter किसको लिख रहे हो? So in this case, the first thing I will do is using the information, write a referral letter to Dr. Shah, consultant obstetrician. So you're writing to an obstetrician means the letter would be like writing to a gynae or obstetrician. That means it would be related to pregnancy for further investigation. So purpose is also given. That is what OET, that is what makes OET so easy. That purpose is already given. Obstetrician for further investigation. Again, this is the address. So yesterday I told you how to write the address. लास्ट में एक थंबनेल वीडियो डाल दूंगा जहां पे लिखा होगा एक्सपेक्टेड लेटर फॉर टुमारो. वो वीडियो भी देख लेना. तो दोनों मतलब अगेन विजिट लेटर विल कम, रेफर्ड बैक लेटर विल कम, ऐसे ही लेटर्स आएंगे, है ना. तो आपको ये समझना है रेफर्ड बैक है या नहीं है. सो फ्रॉम यस्टरडे वीडियो यू वुड बी एबल टू जस्टिफाई इट. लास्ट डेट आई टोल्ड यू अगेन सेम कंसेप्ट. कल भी मैंने यही कहा था. यस्टरडे ऑल्सो आई टोल्ड यू द सेम थिंग. द लास्ट डेट इज द मोस्ट इंपॉर्टेंट थिंग. तो लास्ट डेट में क्या लिखा है? रिमूवल ऑफ आईयूडी अनसक्सेसफुल. दैट मीन्स रिमूवल ऑफ इंट्रा यूटराइन डिवाइस unsuccessful. Unsuccessful when there is anything that is unsuccessful, obviously we need a specialist. तभी तो हम obstetrician को लेटर लिख रहे हैं. That is why we are writing the letter to obstetrician, because we tried something, it is unsuccessful, we need support of a specialist now. Attempted for 15 minutes, unable to locate strings. So we attempted. So basically in our hospital or in our clinic, this was attempted for 15 minutes to remove the intrauterine device, but it was unsuccessful and unable to locate the strings. Patient cannot recall the last time when the strings were located. So even the patient is not sure when was the last time when the strings were located. So patient is not sure. We are also unable to locate. Pregnancy test is negative. So we are all confused. अब हम confused हो गए. We are all confused. Pregnancy test negative. That means IUD should be there. That is why pregnancy test is negative. Maybe it's working. At the same time, we are unable to locate it. हमें मिल भी नहीं रहा है कहाँ पे है. So ऐसा लग रहा है या तो IUD has shifted in the body. Body के अंदर ही है, shift हो गया. Or maybe it has come out of body. It has fallen out. So that is why we are referring the patient to obstetrician for further investigation like ultrasound. So this is the thing. So that is my letter. So again, this was the letter we did yesterday. Just a second. Yeah, these were the pages. So I'm just gonna use this page. So again, purpose is done over here only. Purpose doesn't have to be done separately. Purpose is all done. I just need to know the name of the patient. Olivia Hawthorne. Olivia Hawthorne. That's the name of the patient. So I just need to find the page. So, okay, these are my pages. I'm just gonna write the letter for you. So please, again, make it simple. This letter is being written regarding Mrs. Hawthorne, sorry, who presented to our clinic. अगर if clinic word is given, अगर clinic word दिया तो लिखना है, नहीं तो who presented or the removal of IUD. Again, don't write any word that makes confused. IUD means intrauterine device. So presented for the removal of IUD. Sorry. If I use comma, then I say but. Please understand. If I use comma, तो but use करना है. If I use full stop, तो however. So with full stop, you used however. You use however. However, it has been unsuccessful. Same words. And now this is the best sentence. And the strings have not been located. So that is how you make passive voices. I also want to write like you. मैं भी आपकी तरह लिखना चाहता हूँ. We are unable to locate the strings, but write a better passive voice. यही तो आपको सिखाया है. आपको कहा था whenever you start your OET exam, this chart you have to make. So the people who are having exam tomorrow, past, second form, active, passive was plus third form, and present. This is present tense I wanted to use. So present, it is has plus third form. Note on the answer sheet. You will get an extra drafted sheet. Extra drafted sheet पे लिखोगे आप. और present में passive voice has been third form. So this is the only grammar that you need in OET. So this letter is being written regarding who presented. आप ऐसे भी लिख सकते हो who has presented today. देखना और अच्छा लगने लग जाएगा. So there is no problem. क्योंकि आज को तो हम present में भी लिख सकते हैं. We can write today in the present as well. So I use this active. अपने आप आया है. Who has presented. If I am writing in the past, so I will say who presented today. That is also correct. सुबह आया था ना. था भी बोल सकता हूँ, है भी बोल सकता हूँ. आज आया है या सुबह आया था. Both are correct. Both are correct. So you don't have to pressurize yourself. So who has presented today for the removal of IUD? However, it has been unsuccessful. And अब present में लिख रहा हूँ क्योंकि मैंने यहाँ पे भी लिखा it has been unsuccessful. And the strings have not been located by us. Passive voice. हमारे द्वारा locate नहीं हुए. By us has not been located. Therefore, she is being referred under your expertise on urgent basis for further investigations. Now this is again a nice word, including ultrasound. So I did not say plus ultrasound. So including ultrasound. All done. I will pass. I haven't read the whole letter even. Purpose is clear. Yesterday also I told you the same thing. I will attach another letter. एक और end में letter attach करूँगा. So you would be able to understand that different. These two letters will help you to pass. सिर्फ दो letters. Then let's take it forward. Now again, like yesterday, I will go step by step. Now I would like to know about the patient. Mrs. Olivia Hawthorne. Thorne. So the spelling is wrong. Thorne. Thorne. O-R-N-E. Yeah. So that's the spelling that has been given. H-O-T-H-O-R-N-E. T-H-O-R-N-E. All good. So Mrs. Olivia Hawthorne is a patient at your practice. Practice means clinic. Practice means where you practice. Surgery is also clinic in the foreign countries. So अगर आपको surgery word दिखे वो भी मतलब the patient presented at your surgery मतलब at your clinic. If you do not understand, अगर आपको समझ नहीं आ रहा है तो रिस्क नहीं लेना है. तभी मैंने वहां पे लिखा ही नहीं. देखो, I did not write presented to our clinic or presented to us. Nothing. Who has presented today for the removal of IUD. Today लिखने से it has become a fluent sentence. As soon as I wrote today, it became a fluent sentence. So who has presented today? However, it has been, and the strings have not been located. Therefore, she is being referred under your expertise on urgent basis. So my letter is all done. Hawthorne, 40 years old, 31 recent, Lowtown, social, married, 2 sons, active lifestyle, yoga teacher, non-smoker, social drinker, vegan diet. So I'm telling the uh, obstetrician that she's non-smoker, social drinker, vegan diet, active lifestyle, having 2 kids. Father, Parkinson's disease, So father is having the Parkinson disease. It's not kid's father, it's her father. It's not her husband, her father. Okay. G3P2, three pregnancies, two live children. Three pregnancies she has already done. Three pregnancies she had, two live children. So that is why she is having two sons. 2004, DVT, right leg, while long hours in stressful office job. I don't need this data because I just want an ultrasound. I just want investigation for IUD. Waste. Iron deficiency anemia, maybe, may not be, depending. Can be. 2009, menorrhagia and dysmenorrhea. Not really. I'm not quite sure. Third degree perineal tear. Don't know. Elective E section. I don't know whether we need. I just need an ultrasound for the current situation where IUD, I'm not sure whether it has fallen out or it is inside. That's the only thing I'm worried about. Let's go further. She's taking warfarin, ferrous sulfate. That's okay. Reason for presenting. This is very important. Removal of IUD as currently ineffective for menorrhagia and dysmenorrhea. So I will use the same IUD as it is. These are the two words for grammar. As it is currently ineffective. Rest of the sentence is same. Copy paste. Ineffective for menorrhagia and dysmenorrhea. So now, because I do not understand otherwise, the medical terminology so much, but now I understand this menorrhagia and dysmenorrhea is important because the IUD removal we are doing because it is ineffective. That is why I would include this history. So this is the only history I would surely include. Rest is my wish, but this is now sure because this is has become the main concern now. So let's go further into the story. 15th April, proximal DVT in the left, in the right leg, diagnosed successfully, no further issues. When there is no further issues, it makes me sure that I don't need this thing. मुझे ये चाहिए ही नहीं. I don't need it. Menorrhagia and dysmenorrhea diagnosed in 2009. Array, that was the same thing, 2009. Oh, that's the same history. Menorrhagia and dysmenorrhea diagnosed. So menstrual bleeding, 10 days. That's why Cerazette, this was prescribed. So now, going back to the letter. Simple again. Now I found something. Her medical history reveals that she suffered from menstrual bleeding, from menorrhagia and dysmenorrhea, I guess. From menorrhagia and dysmenorrhia and menstrual bleeding. Okay. So I will say her revealed that she was diagnosed. Let's put up the same words which have been given just with the passive voice because that's the passive voice again. I have written over here whenever anything is done by us or in the past by the hospitals was diagnosed. So she was diagnosed with menorrhagia and dysmenorrhea in 2009. Done. And also she suffered from menstrual bleeding. Same words. I'm just writing and also she suffered from. So I'm just she suffered by herself. That is an active. So that I took from here. That is, and the diagnosis was done by someone. So it was passive that I took from here. That's the only thing you need to take care of. Rest, everything is given to you. Menstrual bleeding, for which is a connector that we use, for which, what was the name of the tablet? Cerazette. This guy. So I hope you all are following me and it's very simple for you as I'm telling as well as writing that it simply goes in that simple way. So this is the only thing I found relevant. So I'm writing only that thing. I'm writing only that thing. Then this medication was seized to conceive child one. So now this medication was seized. So it was seized to conceive child one. Now I can see that over here also she suffered from menstrual bleeding. I could have also done means it's my wish where I want to use the connectors. But if this is good, then also it's fine. Means there is nothing to worry. If I want to change it, I can say like yesterday, menstrual bleeding. For that, again, I told you yesterday, for which when you are using commas, connectors, full stop, then did that, which becomes that. तो which that में convert हो जाता है जब full stop लगता है. तो ये line अलग होगी. Now I can put these two things. Seriously was described, which was seized. Connector which है, which is the connector. तो वो comma को full stop को comma में convert कर देता है. This is what connector means, connecting two sentences. तो which के अंदर वो power होती है. So यहाँ पे मैंने कह दिया for that zero which was seized to conceive child one. That's it. It's my wish where I use my connector. Again, I can take it back as well if you want. Again, there is nothing complex about it. If I want to put comma, then I will say for which, then I would put, means I do not want to make a very long sentence. Chote sentences with one connector. That's it. That's the only motto. Then I go to this information again. To conceive child one. In 2012, menorrhagia and dysmenorrhea got worse. See, whenever you find the worst word, you just write got worse than pre-pregnancy. So this medication was stopped. She conceived child one. So now she had one baby in 2011. In 2012, menorrhagia and dysmenorrhea returned, which was worse than pre-pregnancy. So पहले से भी ज़्यादा worse था. Combined pill Silicet was prescribed. Same lines. Child in 2011. The following year. So this is what I do better. These are the words I like to change. So in 2011, to the following year means the next year, that means 2011. She, or maybe I will use the same sentence, menorrhagia and dysmenorrhea. So menorrhagia and dysmenorrhea got worse than pre-pregnancy. So Silicet was prescribed, whatever the name of the medication was, Silicet. Let me combined pill Celeste. So combined pill, same words. So combined pill. So I want to tell the history to doctor. Combined pill Celeste was prescribed. Is the name of the medication. So I have put it in capital letter. This is my punctuation. ये मेरी punctuation है. किसी चीज का नाम, medication का नाम बड़े अक्षरों में. This is what tells examiner. यही तो examiner को बताता है कि आप intelligent हो. छोटी छोटी चीजें. That's it. Then done. Data is all going fine. So again, let's see what happened next. This medication was stopped to conceive child 2. And then in 2015, whatever menorrhagia returned with menstrual cycle, IUD marinacol inserted. So now what is happening? Again, I'm just following the pattern. So it was also seized to conceive child 2. And after that, and after some time means because it's just because of the misprinting. I do not know what to write. If it's 13, then तो I can write after that. अगर ये 13 है तो मैं लिख सकता हूँ after that. लेकिन अगर ये 15 है, let's see यहाँ पे कौन सा year दिया है, या 15 हो सकता है क्योंकि ये 18 है. So मैं उसको 15 मान रहा हूँ. So after 2 years, menorrhagia returned. So after 2 years, menorrhagia returned fast with menstrual cycle. For which IUD coil, what was the name? IUD Mirana coil was inserted. So these are the two paragraphs I have written from the first page. So simple. Just following my grammar, and this, whenever worse word is there, you always write got worse. Got improved, got worse. Got improved whenever you want to use worse and improved word. So this condition got improved, this got improved, this got worse. Simple. Then pre-pregnancy, then word was given, then means comparison. That's it. Done. It's all good. It sounds good. Now let's go to the next page. Again, making it as simple as possible. Next page. Let's see what is the next page. Menorrhagia in 2018, menorrhagia got improved. No more dysmenorrhea, no menstrual bleeding. since fitting, vaginal thrush, patient treated with this since last. So everything was fine. Everything was fine. But in 2009, there was a in 2019, menstrual spotting was there for 3 months. Experiencing menorrhagia and dysmenorrhea again. So she started having the problem again. So I tell the doctor that, so it was done in which year? 2011, the following year 2012, and then she conceived child 2. Then after 2 years means that is happening 2012, 2015. Then I'm saying in 2000, let's see, in 2018. So in 2019, basically I'm mentioning the same year. In year 2019, she again noticed. She again suffered from menstrual spotting. I'm writing just relevant words. That is where I'm decreasing the word count. Menstrual spotting for 3 months. And also, this is the problem. And also, menorrhagia and dysmenorrhea. What was the word given? Also, she experienced menorrhagia and menorrhagia and dysmenorrhea. Returned, but I have already used the word returned over here. Right? This returned. So I won't use the, and also she started experiencing. So I'm just using the same vocabulary. She started experiencing MI and dysmenorrhea again. So she again suffered from this and she started experiencing dysmenorrhea. So this is happening again. Or I can say she suffered from menstrual spotting from 3 months and she started experiencing dysmenorrhea again. So again is right, looking better over here. अगर मैंने पहले लिखा था, if I would have written earlier, then also it was fine. But now this is here. So removal of IUD with nurse prescribed. Therefore, removal of IUD with nurse was suggested. So you are the nurse, you were given the suggestion that this was done. Today, she has presented. That is how simple you write. Don't go for every word. Otherwise, word count will also become more and you will also suffer more. So the main thing is this. So that is where I am to the point. She has presented for the removal. For its removal, I want to correlate. So IUD was, so it is connecting with this. Removal IUD was suggested. She has presented for its removal. But it has been unsuccessful. Now I will write the complete story, even after attempting for 15 minutes. Now I will write the completed. The first paragraph I write only information what I feel is like more relevant. And it can be different. For me, it can be a different. मेरे लिए वो information अलग हो सकती है, आपके लिए अलग. लेकिन हाँ, basic words should be covered. Removal of IUD, it has been unsuccessful. Strings have not been located. Otherwise, even if I miss out on this thing, even then it is not a problem. Even if I do not write this thing in the first paragraph. But in the last paragraph, I want to write the details. So attempting for 15 minutes. Strings have not been found and the patient, now I want to say we also did not find and the patient also does not remember the last time when they were located. So even the patient doesn't remember, we do not know. So that was the line that was given. Unable to locate, patient cannot recall the last time strings located. So I use the same word, patient do not recall. And patient is a singular word. That is why I use does. These are the small things. I do not do my work. She does not do her work. So patient is a singular. So she does not remember, recall the last time. Even the patient also does not recall or could not recall. This is a better word. Itna bhi nahi. She could not recall the last time when it was located. So pregnancy test is negative. Pregnancy test is negative. It is suspected. This is common. It is suspected. So you can use a different word now. So that will make it more fluent. Now it is suspected that IUD, IUD, when I'm writing IUD again and again, I would write the complete form over here if I know it. If I do not know it, I do not take any chance. But if I know it, then I will write here IUD. Okay. So intrauterine device. Okay. And here I am saying pregnancy test. Now it is suspected that IUD has, this is grammar, has either, means या तो ये हुआ है या वो हुआ है, has either shifted or has fallen out. Now sometimes you guys have problem in grammar. Sir, why shouldn't we put been? Then I ask you a simple question, that is it done by you? आप passive voice बना रहे हो, has been third form. Has been third form तो is a passive voice. So is it shifted by you? No, it has happened itself. So it's an active voice. So that is why in active voice you say has plus third form. So active है, active को IUD has either shifted or fallen out, for which and that's why and so sorry. So because I, for which I have already used two times, so that is why I'm avoiding it. So your expertise is highly required. Over. Word count. How simple it is. Now the letter that will go to the examiner, Mrs. Hawthorne, who presented today for the removal of IUD. Don't worry about what you have not written. Worry about what you have written. इसके बारे में सोचो जो आपने लिखा है वो कैसा लग रहा है, पढ़ के देखते हैं. Who has presented today for the removal of IUD. It is currently ineffective. It has been, however, it has been unsuccessful. The strings have not been located. Therefore, she is being referred for further investigation, including ultrasound. Her medical history reveals this. 2019, she suffered from this, and also she started experience again. Therefore, removal was suggested. Today, she has presented for its removal, but it has been unsuccessful even after attempting. Strings have not been located. Patient also could not recall the last time when they were located. Now, pregnancy test is negative. Now it is suspected that IUD has either shifted or has fallen. So your expertise is highly required. That's it. Should you require further information? Feel free to contact. This will not come in the word count. And again, small things, please start from the left, leave a line. That's it. So these are the 4 paragraphs I have made. Leaving a line, starting from the extreme left. This line will not be counted in the word count. Done. Yours sincerely. Again, like yesterday I said, why yours sincerely? Because the name of doctor is given. A second. So yours sincerely. Who am I? Who am I? I am a registered nurse. So I'm a registered nurse. And the same letter can come to the doctors. This is just the same. Name has not been given over here. Now, how do you start the letter? This will come in the drafted sheet. So I'm taking it off. But you will definitely use it. You will write in the rough sheet or question paper about this grammar thing. It is very important before you start. Write your grammar. Okay. Now, the last thing that I want to write to this thing. Dr. Shah, Dr. Miriam Shah, consultant obstetrician, Royal Hospital, Lowtown. Dr. Miriam Shah, consultant obstetrician. What was the name? Royal Hospital, Lowtown. This is where you will start. Dated, what's the date today? 6th 4/19. 6 4 means April 2019. Regarding Mrs. Olivia Hawthorne. How simple. It's just doesn't take even like 20 minutes. Just write only easy things. As you can see, I have missed out many things. But I have told obstetrician that main thing is IUD removal, which has been unsuccessful. We don't know where it is. That is the main thing. So don't think about medications too much, this and that. You could have clubbed both the things as well. It doesn't make a big difference. The main thing should be there. Hawthorne, aged 40. And then you write about, dear Dr. Shah. Even if by chance you shuffle this thing, let me take it from here to here. That's also fine, not a problem. These two things can be interchanged. That's it. Our itna sa likhna hai. Now my letter is this is a complete format of OET letter. This is how it appears. Such a small thing. Chota. That's pretty much it. Please take it that easy as it is appearing now. Only write the main things. Don't worry about too difficult things. This is Dr. Bhupesh from Dr. BKM Institutes. I hope you guys have all understood. I would really appreciate if you would have any doubt to ask me, but for now, I'm just going to stop the recording. Thank you.